All right, in this video, I'm going to show you how to um, get your tibialis anterior muscle to start activating, learn what it should feel like, which you can then carry over into other exercises to help regain some foot and ankle and knee mobility with tibialis anterior reactivation or activation training drills. So you're going to go with at least your shoe off, if not your sock as well. Now, the tibialis anterior is a muscle that runs along the outer aspect of your shin. So you have the hard ridge of your shin bone here. And then just outside of it, you have this long muscle that then turns to tendon and then crosses over the front of the ankle and then attaches underneath the arch of the foot over here. And so the primary actions that the tibialis anterior does at the foot and ankle is it helps dorsiflex the foot or raise the foot up, as well as turn it into inversion like so. So you're going to start in sitting because this tends to be the easiest way to start to focus on getting that tibialis anterior to activate without having to worry about your balance and stuff like that. Now from here, you essentially want to do the combination of those two motions that I just showed. So dorsiflexion and inversion at the same time to create this dorsiflexed and inverted position like so. And when you do that, you might be able to see it on the video here, but you can see the tendon of my tibialis anterior popping up right in the front, slightly medial aspect of my ankle right here. And if you're having trouble seeing it, you can even just place your hand here and then start to do that motion like so, and you should literally feel it pop into your hand. Now, if that's pretty much all you can do, that's totally fine. Once you get the hang of getting that tibialis anterior activated, another way to help confirm it, because there are other tendons that run across the top of the ankle joint right here, you can also place your fingers in the belly of the muscle here and then do that same motion, and the same thing should happen where you should feel that muscle contract, stiffen up, and it should literally like start to push your fingers out. So once you, I would say, like do like 10 or 15 of those just to get the hang of feeling that tibialis anterior activation. And then from there, we're going to progress it to keeping the foot stationary, not allowing the foot to move, and still trying to get that same activation of that tibialis anterior. And so the way you can think of it is imagine like, so you want to maintain all 3 points of contact of your foot against the ground. So you have your heel, either the center, like dead center of your heel, or maybe the inner half of the heel. So if I traced a U around my heel, cut it in half, that inner half, you want that, the knuckle of your big toe, and the knuckle of your pinky toe. All 3 of those points in contact with the ground the whole time. And then from here, imagine like you're trying to perform that same motion of dorsiflexion and inversion without the foot actually moving. And you should still be able to palpate the tibialis anterior muscle belly popping into your fingers here, and you should either see or feel that tibialis anterior tendon popping into your fingers as well. Now, programming wise, if this is too difficult, if keeping the foot stationary and then trying to get that muscle to activate, if this alone is too difficult, then it's totally fine to stick with this motion here. And the way I would program it is maybe do 10 to 15 reps with the active movement itself. And then from there, what you could then do is then try and hold it there and try and maintain that muscle activation and that tendon popping out in the front of the ankle for a solid 10 to 20 seconds. And you can do 3 to 5 sets of this to really just try and get that mind muscle connection of getting that tibialis anterior activation. And then from there, after you practice it enough, you should be able to then maintain all 3 points of contact in the foot and then do that same exact thing of getting that tibialis anterior activated and being able to feel it poking into your fingers. And then you can even challenge it, do the same isometric hold it for 10 to 20 seconds, keeping that muscle activated the whole time, all while maintaining your 3 points of contact in your foot.